As an ER doctor, I can tell you 1 in 5 people who break their hip will die within a year. And it starts decades before that fall. A hip fracture doesn't just break your bone, it breaks your independence. Here's what I see in the ER almost every single day. Hip fractures are always devastating, not just because of the break, but it's because of what follows: loss of independence, prolonged rehab, complications, and sometimes death within a year. And here's the part that matters most. The problem didn't start with that fall. The fall was just the final event. The real issue is bone loss that's been developing quietly for years. That's what osteoporosis is. Bones becoming weaker and more fragile over time, often without even symptoms, until one day a simple fall causes a catastrophic fracture. This is why DEXA scans or bone density scans matter so much, because these measure bone mineral density and give you an idea of what your bone density is. You get what we call a T-score. A T-score of -1 or higher is considered normal. Between -1 to -2.5 is osteopenia, early bone loss. A T-score of -2.5 or lower is osteoporosis. And that bone loss doesn't happen overnight. It's influenced by aging, hormones, nutrition, and especially the lack of mechanical loading. Because bone is a living tissue. You either lose it or use it. Walking alone isn't enough. Pilates is not enough. Bones need heavy resistance to stay strong. That means pulling, pushing heavy weights. In addition, for perimenopause or postmenopausal women, hormone replacement therapy should also be considered to avoid bone loss. The takeaway is this: hip fractures don't come out of nowhere. They are the end results of years of unaddressed bone loss. So if we care about longevity and our independence, we have to stop reacting to fractures and start preventing them. Because once a hip breaks, everything changes. And I've seen that story far too many times.